right now there is a lot of attention on COVID-19 and the vaccine, but life continues for every other individual and some of the other health issues that they are experiencing that. And they can't just pause their health issues. And so joining us now on the show is Dr. Adam Kuhlman. He's the director of Movement Disorders Clinic at Beaumont Hospital. Doctor, thank you for being with us.
It's great to be with you. Thanks for having me.
So when we're talking about movement disorders, what exactly are we talking about? Because immediately what comes to mind for me is Parkinson's disease.
Yeah, you're exactly right. So, movement disorders is a subdivision of the field of neurology. And kind of broadly speaking, movement disorders include neurological conditions that cause either too much movement or too little movement. And so Parkinson's disease is, one of the things that I treat, mainly in my practice. Other common examples of things that we treat often are things like essential tremor, other forms of tremor, tics and Tourette syndrome, restless leg syndrome, and others.
So how has your area of expertise been impacted due to the pandemic? Because we do know a lot of people are just afraid to go into a hospital setting or even a doctor's office to try to get help from some of these issues. Or if they are in the beginning stages, do you see some of your patients reluctant to identify and go to a doctor right now?
Yeah, definitely. I think that, especially originally, we're going down almost a year ago, I saw a big drop off in the volume of patients that I was seeing on a day-to-day basis. Kind of midsummer into the fall, things kind of seemed to return back to normal. And then as we kind of saw that spike in cases again around Thanksgiving time, that volume kind of dropped off again. We transitioned over to doing a lot of telehealth visits, which has been very helpful. It's been a learning curve for everybody, but I think that that's really added a valuable resource for people to be able to stay at home, but still be able to seek medical care for some of these chronic conditions that they're dealing with.
So tell us about the telehealth experience for you, and how are you able to treat some of these patients? Because even for us here on the show, some people just aren't tech savvy. So how do you try to not only navigate your health advice, but also walk them through some of these technical issues as well?
Yeah, it is definitely been a challenge. I will admit. I think that we've all been forced to jump onto that train and learn along the way. The other component is a large portion of my practice is composed of patients that are older than the age of 65, and some of them prefer just not to have to bother with some of the telehealth type of things. And so we've adapted. We're trying to offer other avenues, and so there's still some in-person visits. We've done some telephone visits, and then the video visits, which we've tried to make as easy as possible. And I think for the large part, it's become much more acceptable for people to be able to get the help that they need.
I'm thinking about this because I do have some friends that are elderly and trying to say, hey, I'm just a text person now. Like, I don't want to talk to you on the phone. You need to text me. And like trying to get them to text, they're like, no, they're going to call. So I'm thinking about you and your staff, and then you have the serious issue that you're trying to help them with, but you're, faced with some of these technological issues, but also it's the mindset issue as well on top of that. But if we can go back, so what are some of the signs of people who are in the beginning stages? What should they be looking for?
In terms of?
If they're noticing tremors and something's just off with their body.
Right. So, that's, what I'm here for. I think a lot of people's mindset first goes to, oh my gosh, I have tremors, this is Parkinson's disease type of a thing, because that's what a lot of people identify, tremor with most commonly. But there's, a number of different conditions and things that can cause tremor. And that's why it's important to be able to seek out some of that expert evaluation. And that's, part of the reason why we have a movement disorder division here at Beaumont.
So with that, as far as individuals, what is the age range that we're looking at? Because I've had families members that have experienced some of these issues, but we associate it with people that are elderly. Is that always the case?
No, in fact, it isn't. I mean, when it comes to Parkinson's, on average, we see the average age of onset somewhere in the neighborhood of 60 years old. That number shifts around a little bit depending on what sources you read. But in the case of something like essential tremor, we see, what's called a bimodal distribution, meaning that we see new cases in people that are in their teens and maybe 20s, and then new cases in, people who are still, working in their 50s. And so it doesn't simply affect people who are elderly. It can affect people that are younger as well. But we do see that there are increasing numbers with age.
So with that, you're saying there's a wide age group. Is there a sign that people should look for, or can some of these things happen where it's just like this moment of time, nothing for them to worry about? Or could some of these symptoms and signs be that there's a greater problem, and that's when they should search out medical expertise, such as what you offer?
So, yeah, I mean, very often these conditions that I treat, start, very mildly and are very slowly, kind of progressive in nature. So, you may notice that there's a little bit of abnormal movement, a little bit of abnormal shaking in the hands when, drinking a cup of coffee, or when, handwriting or doing some other kind of simple task with the hands. And that might initially come and go and not really interfere with any daily activities. And then as time goes on, that tremor may become more prominent and start interfering with daily activities a little bit more. And it's at that point where we really start to encourage people to seek medical attention, and because there are treatments that are available.
So what are some of those treatments? I know earlier you mentioned medication may help as well.
Sure. So a lot of that depends obviously on the specific diagnosis, but there, based on those diagnoses, there are a number of medications that are available for things like essential tremor. We often use, medications that are called something called propranolol, or another medication that's called primidone. And for many people, that those are sufficient to, reduce and dampen the tremor that they're experiencing by 50 to 80%, something that's meaningful in terms of being able to have legible handwriting, being able to drink from an open glass, or soup from a spoon, for example.
It's interesting because I remember when back during election time, we were talking with the clerk and just talking about your signature and how it could change over time when you're having some of these medical issues. So it's great that you mentioned that. But can some of these issues be treated with physical therapy, or is this solely something that needs to be handled through medication or surgery?
So yeah, there's a broad range of treatment options that are available. In the setting of something like essential tremor, we try to employ a multidisciplinary approach. Same goes for Parkinson's disease, for that matter, where there's medications obviously, but there's physical therapy, occupational therapy. There's a number of kind of non-pharmacological interventions to help with some of those daily tasks. There's weighted silverware and utensils, kind of altered writing implements to be able to make that task a little bit easier. Different kinds of software on your computer, speech to text and things like that, so you don't have to be using the keyboard or mouse quite as much. And then there's, for when those strategies fail, then we do have some surgical options that are also available.
Jack, how did you get into this line of medical practice? Because you just seem so young. You're like Tony Hauser. Where's your bow tie?
I've been accused of looking young in the past, that's for sure. So, the field of neurology was always, very attractive to me. That the neurological system is, so wonderfully complex and elegant in nature. And I loved the kind of physical diagnosis of things and movement disorder. It just took that to an entirely different level for me. And then what kind of sealed the deal was the first time that I saw someone with essential tremor who had DBS that was implanted. DBS stands for deep brain stimulation. And I saw this person who had this just really terrible tremor, very disabling, couldn't eat, couldn't drink, couldn't write, really needed assistance with a lot of daily activities. And we, did this initial programming, turned on this device, and you just see this tremor melt away, and kind of give this person their life back. And it was this sense of just immediate gratification that, we just don't really get very many other places in medicine. And so I saw that and I was like, I'm hooked, I got to get more of that. And so, and the rest is history.
Really, it could be life-changing for that individual, right?
It truly can, yes.
And so when you have patients that come to you and they have this dread about what their future may be, what do you tell them? Like there is hope at the end of these diseases?
Yes, there's a number of different things that we can do for these types of conditions. And that's one of those kind of misconceptions that I think, a lot of people come into the office with, that especially for things like tremor, some people refer to this as, this is their family shakes. This is, there's a very strong kind of family history of this type of tremor with them. And they just they're of the mindset that there's nothing to be done. This is just kind of how things are. And that, really nothing could be further from the truth. And so there is that kind of that light at the end of a tunnel.
So when you mentioned about the family traits, how much of this is genetic versus lifestyle?
So for essential tremor, we see that there's a family history in about 50% of people. Again, that figure, varies a little bit from source to source, but we see there's about 10 million people in the United States that have essential tremor, and half of them have this family history. We don't fully understand what causes essential tremor. We see some people with this family history, some don't. People who do have that family history have been able to identify some genes, but not been able to identify them in others. And so this is a subject of ongoing research.
So I'm sorry for all the questions, but this is the first time we've had you on, or anyone that I can remember, talking about these issues, which are really prevalent in so many families as well. But is it hard to get information out to the public about this issue? Because we're very familiar with Parkinson's disease just simply because of some of the high profile individuals that it's been associated with. But some of the other diseases that causes these symptoms, is it hard to break through to get your message out during these times?
These times, yeah, I think especially it's been a little bit more difficult. And, it's one of those things, again, where this is something that kind of just flies underneath the radar for many, that, the tremor might be very mild, nothing more than really a nuisance. And then as time goes on, that might escalate and become more significant. And we, really try to, engage in some outreach, but yeah, it is certainly a challenge for us.
So is it important for people that are starting to experience some of the symptoms, is early detection and early treatment better, or does it play out the same one way or another?
Yeah, the kind of unfortunate reality of some of this is that we don't have anything that's, what we would refer to as disease modifying, nothing that necessarily slows down, the course of things or changes, the future prognosis. However, we have a number of interventions that can make a significant difference in day-to-day functioning for people. So from that standpoint, I think that early detection is important, because that means that we can intervene and give some of that life back during those years when they may otherwise have not had any other options. So, I don't know if I'm able to share my screen. I do have a short little video to kind of show you an example of what that might be.
I think we can share your screen, but let's see if we can bring Larry in. He's our Zoom producer. Can you try to share it now?
Yeah, I made him the co-host. He should be able to do it now.
Okay.
So let me share this with you. This is a gentleman with essential tremor, and this task that's just like addressing an envelope can be really quite problematic and difficult. And also, again, here, if you're able to see this with me, the task of just drinking from a mug and bringing it up to the lips is, really quite difficult. Requires a little bit of steadiness and stabilization of that mug. It's not difficult to imagine. Some people, would refrain from going out to a restaurant because they're concerned about, spilling all over themselves or onto the table and things like that. And this is after a therapy that as deep brain stimulation, the same gentleman with stimulation on. And this is the thing that I mentioned to you that really kind of got me into this field to begin with, that handwriting is substantially more legible. And another thing that I think is really quite powerful, he has the ability with a patient programmer to turn the device on and off. See that melt away, which is really just quite powerful and amazing. At least it is to me. So thanks for letting me share that.
I'm with you. I think that's absolutely amazing. And with that, so when you say he's able to turn the device on and off, so this is something that's implanted in an individual.
That's correct. Yeah. So the therapy that I was showing is something that's called deep brain stimulation. This is a surgical therapy that involves implantation of a very small electrode into the brain itself, into an area that's called the thalamus. The electrode's about the size of a strand of thin spaghetti, and then that's connected to a kind of pacemaker device that's located in the chest that delivers a very small, high frequency pulsatile electrical stimulation that is able to achieve that tremor effect that you just witnessed.
I'm sitting here in awe of you right now. But with that, what is the turnaround time? Like from the time that they have the surgery to the time that they see the improvements?
So the surgery itself is done in 2 stages, about 2 weeks apart. The first surgery requires an overnight stay. And then the second surgery is an outpatient surgery where it's actually connecting that electrode to the implantable pulse generator. That's the battery and computer. And then shortly after that, you come into the clinic with someone like myself, and we turn it on and program it for the first time. And so we're seeing, from the time you first have the surgery to the time you see someone like me, it's about a month after the surgery that we're doing the initial programming.
So what's the long time recovery? Do they have to come back every so many months, or is a second or a third, fourth surgery required so many years down the line?
So nothing that's in comparison to that first surgery that they undergo. There are sometimes some periodic battery replacements that are required once every 5 to 7 years. There's some batteries that are FDA approved out as long as 15 years. And the recovery just immediately post-surgery is, again, in that kind of 4 to 6 week range, where there's some limitations in terms of return to work, but people are still able to go about their daily activities in the meantime.
Well, Dr. Kuhlman, I am so sorry for taking up so many of your times, but I find you and this work fascinating because you're making such a huge difference in so many people's lives. Anything maybe I didn't ask about, because you are the expert, that you want to share with our listeners and our viewers before I let you go?
Just that if anybody, is experiencing any of those symptoms, you can learn more at the beaumont.org/neurology website. You can also contact our clinic. The phone number is 855-863-8761.
I didn't even realize that there was such a clinic. But again, you're the director of the Movement Disorders Clinic at Beaumont Hospital. We so appreciate your time this morning.
Thank you. I appreciate being here.
But also, what great work that you're doing. So making a difference, because the one stat, up to 10 million Americans estimated to have essential tremor. So that is a good statistic to know that people experiencing some of these symptoms really need to reach out, even during the middle of a pandemic, and ask for help.
Yeah, so please seek medical attention if needed, for sure.
Absolutely. Well, thank you again for your time. We appreciate it.
Thank you.